Hi there, my name is Collin Kwasnik and I'm a dentist for the University of Vermont Medical Center. So why did I decide to pursue dentistry? Well, I'm one of 15 kids. My parents adopted, or had 5 kids, then adopted, the rest. And many of the ones that were adopted were from other countries and had cleft lip and cleft palate. Now, if you don't know, cleft lip and cleft palate is when either the lip or the palate itself does not fuse together. So your lip can be split in the front, and the same thing with the palate going down back towards the throat. They can be split apart. This can cause problems with eating and obviously talking, aesthetics, all those sorts of things. So growing up in an environment where my siblings had those problems and seeing the difficulties that they experienced turned me on to dentistry, I think, from an early age, and seeing how the doctors could help them and how rewarding that was for them was something that always interested me. When I got to college and I didn't really know what I wanted to do, I was always very interested in science and biology and healthcare. So I knew I wanted to become a doctor of some sort. I just didn't know what type. I spent some time shadowing several different types of doctors, both physicians and dentists, and I realized that the dentists really fit my mold a lot better because the flexibility in dentistry is greater if you own your own practice. The business opportunities, if you're interested in business and entrepreneurial, is greater in dentistry. And the lifestyle and the procedural aspects of dentistry and working with your hands was something that was more exciting to me. In addition to that, my mom and uncle were dentists, so it only seemed fitting for me to start shadowing and pursuing this career. And once I started that process, I realized that it was something that I wanted to pursue and to go after. So there's a specific pathway that one needs to take in order to become a dentist. The first step of which is to get your undergraduate degree. Now, this doesn't have to be in any science-related field. It can be in absolutely anything that interests you, but you do need to have a degree from a university or college, a 4-year degree, and you do need to take the prerequisite courses that are required by dental schools. Typically, these are all the same courses for each dental school. Some might require 1 or 2 different courses, but you don't have to worry about that just yet. That's something you'll look into when you're in the application process. In addition to the prerequisite courses and the undergraduate degree, you also need to take an admissions test. The admissions test is similar in concept to the SAT for college, but in this case, you're taking this exam in order to compare your scores to other applicants in the field and enhance your chances of getting an interview and getting into the dental school. So you've completed the 4 years of college, you've taken the dental admission test and you scored great, and now you get into dental school. Dental school itself is 4 years, so that's 8 years in total after high school, and that's just to become a general dentist. If you want to specialize, that depends on the specialty and can be anywhere from 2 more years after dental school for a total of 10 years up to 6 more years after dental school, which would be a total of 16 years after high school. Those specialties range based on the complexity of the specialty. So oral surgery being the most complex and the highest number of years required after dental school, between 4 and 6 years. So that's the basic path to getting into dental school, and it's a long road, but it's definitely worth it and very rewarding. So as a dentist, we do many procedures, and we specialize in the oral cavity or the mouth, the teeth, the gums, and the bone, all in this area. And more recently, a lot of dentists have also been getting into the airway and things like sleep apnea, which is when someone stops breathing when they're sleeping, and how you can reposition their jaw in order to decrease their sleep apnea and increase their ability to breathe when they're sleeping. Most people think of dentists as just drilling out cavities and putting in fillings, and yes, we do that, but dentistry is so much more than just that. As a dentist, you can move the teeth in someone's mouth in a way that makes it not only more aesthetic, but allows them to speak. We don't think of teeth as allowing us to speak, but the air that comes out of our mouth and the noises that we make has to do with how our teeth and lips are positioned. So if you lose teeth, or those teeth are rotated, twisted, turned, etc., then it could cause difficulties with speech. In addition to that, eating is such an important component of life, and when you lose your teeth, it can impact your ability to eat and your quality of life. So we do a lot of work with obviously keeping teeth in someone's mouth and preventing disease from occurring and that tooth loss from occurring, but also what do we do once the teeth have been lost? And I joke about this, but the D in dentist is for doctor because we go to school for so many years. The E is for engineer because the appliance or the prosthetics that we make, or the fake tooth, the denture, all those sorts of things have to be done from an engineering component, an engineering mindset, because they have to be able to withstand the temperature changes in the mouth, such as when you drink hot coffee or drink ice water. They have to be able to withstand the forces, hundreds of pounds of force that are applied on them every time you chew, and not only forces in one direction from chewing like this, but horizontal forces and things like that from when you grind, etc. So the D is for doctor, the E is for engineer, and the ending, the tist, is for artist, because so many components of dentistry are artistic and based off aesthetics. You think if you saw someone and they didn't have nice teeth, it would completely change their overall appearance. And well, we mostly focus on treating disease and getting someone out of the disease state first. Aesthetics and the artistic side of dentistry is a big component in how we build those restorations and how we move their teeth to make them look and function in an aesthetic way. So as a general dentist, you can do all of those things. You can do surgery, such as taking teeth out, which is known as an extraction. You can reshape the bone. Maybe you need to remove some bone in order to allow room for a prosthetic appliance. Maybe you need to reshape the gum tissue. Those are called plastic procedures. It's similar to like a plastic surgeon, changing something about someone's body. You can do endodontics. Endodontics is a specialty in dentistry where they specialize in treating infections that have gone through the tooth and now are affecting the nerve and blood supply inside that tooth. You can do pediatric dentistry where you see kids. You can do geriatric dentistry where you see elderly people. Radiology is a huge component of dentistry, and we look at CT scans. We diagnose x-rays constantly all day long. So being able to understand, read x-rays both in the two-dimensional plane, typical radiograph, or the three-dimensional planes, which is seen on a CT scan. In addition to all those things, my favorite part of dentistry is the relationships I get to establish with the patients. And you can see a patient for your whole career, 40 years, and you see that patient, you see their kids, you see that patient's grandkids. So having those relationships and seeing those patients frequently is, to me, one of the most rewarding things in dentistry. So a normal workday in dentistry involves a lot of problem solving. So a patient will come in with what we call their chief complaint, or the main problem that they're having. It can be, my tooth hurts, I have an infection and a swelling, my teeth aren't straight enough, I've lost these teeth and now I bite funny and I can't chew. How do we fix those things? So as a dentist, you need to be able to diagnose those problems and be able to form a treatment plan and give the patient several options that allow them to pick which one they'd like to go with to solve those problems. my typical workday, a lot of it consists of doing fillings and extractions just because of the location and the practice that I'm currently at. As a resident, we go on several rotations, one of which is at the Community Health Center in Plainfield, Vermont. So I'm seeing a different patient population than most dentists would likely see. Dentistry, in a typical dental workday, you'll see about 7 to 15 patients of your own, all of which you're mostly doing either procedures or exams on. Then you'll also see patients, maybe another 7 to 10 patients who come in to get their teeth cleaned by the hygienist, and you'll see them to do an exam and make sure that everything's going, good, and they don't have any cavities forming and things like that. So a typical dental day consists of, seeing patients all day long, doing lots of procedures, which can vary across the board and be extremely diverse. And you are always, most of the time, always working with your hands. Because it's a very procedure-based occupation, you're always working with your hands trying to fix something or do something. So if you enjoy working with your hands, don't want to sit at a desk and do a desk job, dentistry is one of the occupations in healthcare that allows you to do that. So what might make a student a good candidate to pursue dentistry? Well, if you enjoy healthcare, the health-related fields, if you enjoy medicine, if you enjoy helping others, and want to work with your hands and do get into an area of medicine that isn't, it's very procedural based, dentistry is a great option. In addition to that, if you enjoy business and if you're entrepreneurial, dentistry offers many opportunities to own your own practice and be a small business owner. And if you enjoy engineering and artistic components, then dentistry is also a great choice. And if you are interested at all, I would encourage you to talk to your own local dentist or reach out to me, and I'd be more than happy to have you shadow and discuss in more detail to see if dentistry is something that you would like to pursue.